A recent health survey found people have trouble believing their extra pounds are weighing into their poor health. In fact, obesity-related problems are a huge health indicator.
All of the chronic diseases that we deal with, high blood pressure, cardiovascular disease, diabetes, they're all related to weight problems. It's anticipated that the next generation will not live as long as this current generation if things continue to go the way they are.
Still, more than 53% of men didn't think their weight was a problem, and 48% of women felt the same way. Experts see a rise in obesity that parallels the rise in diabetes.
With our aging population and with the increased prevalence of obesity, I believe this trend is going to continue to rise. As you gain weight, you become more insulin resistant, meaning that you can't use the sugar or glucose in your blood.
Cardiovascular disease is the #1 killer in this country. Excessive weight is also a contributing factor there. Doctors use body mass index to gauge heart health.
A lot of people with these high waist sizes or the high body mass index develop what we call metabolic syndrome, and that's becoming more and more common in our country with increasing weight. The metabolic syndrome tends to carry with it a higher risk of cardiovascular disease, so a higher risk of myocardial infarction, higher risk of stroke.
The CDC reports obese people show up more in emergency rooms compared to the general population, this disproportionate rate being linked to crisis intervention. There is a solution to this heavyweight problem.
Research has shown that even with a modest weight loss and regular exercise, and when I say modest weight loss, it's 5 to 10% of your body weight, you can reduce your risk of developing diabetes by 58%.
Discussing weight may be a sensitive issue, but one you should take up with your doctor. For Lee Memorial Health System, I'm Amy Osher.